Okay, am I supposed to let all these people in? 39?
Well, there's the CEO.
Yeah.
At least we got her going.
Hi, Dr. Eric. How are you?
Good. How are you?
Good.
Nice to see you.
Nice seeing you as well. How's everything in San Francisco?
It's fine. It's just
Go ahead.
a lot of crazy people. A lot of people are scared.
I'll be coming out there a whole lot more. My son and his wife just told us they're having a baby.
Oh, congratulations. That's awesome.
You know, so I'll be coming out more and more and more
Okay. We'll break some bread.
and whiten my teeth.
Okay. All right. Do both of those.
There you go.
That's great.
This virus is making everybody crazy, isn't it?
Yeah.
Hey, Eric.
Hi.
Yeah.
Okay, good. So thank you, everybody, for joining us. There's a lot of friends on here and a lot of strangers, too. So they're going to be friends pretty quick, I think. You can see me. I'm Shirley Gutkowski. Philip is there as our office manager at Primal Air. And there's Eric Sorensky in California at his office, his closet in his office. And we are here to kind of talk to you and help you understand the role that ozone can play in a post-19 dental practice. And we're just living in these really, oh my God, times. We just don't even know what's happening. We don't know when it's going to happen. We don't know how it's going to happen. We don't know what's going to happen next, and what's real and what's not. Everything changes all the time, and we're getting up to the minute information and changes, but it sounds like there's nobody knowing what they're talking about. And so we have to kind of take a couple of steps back. So what I want to do is remind you that aerosols in and of themselves are harmless. That aerosols are just really water droplets or liquid droplets. It's what's on the aerosol that gets us into this twist where we're all like, oh my God, what's happening? Everything, the world is crashing. If you can see it or if you can't, depends on what you're actually going to call it. So the way that I want to describe it is that it's a liquid that's either visible or invisible. There's things called fomites that are big droplets, and there's droplets, but right now for what we're talking about, we're just going to say aerosol, and you may or may not see it. The thing about the aerosol, though, is that it contains a bioburden if we allow for that. So there are a lot of things that we can do if you separate those two concepts out from one another. We can control the bioburden on the aerosolized liquid in our treatment rooms. We can do it by using some really high level, high volume suction. A lot of the holistic dentists have been for a long time using these kind of external suction devices. I'm sure Eric can tell us a lot more about it, but mostly they've been using it to eliminate the fumes from amalgam removal. And we can use them now as dental hygienists to reduce the aerosols that are coming from our aerosolizing procedures. If you're using a piezo scaler, you're not going to have as much water or aerosol or plume as you would if you were using your basic Cavitron. So really separate things out and really think about what it is that you have available to you and how you can use it. For instance, the Canberra model. give me a break about CAMBRA, right? CAMBRA stands for Caries Management by Risk Assessment, when really it was always about manipulating the oral biofilm to be healthful before treatment was started. That's the crux of it. So what if we did that to our patients right now? What if we reached out and said, why are you bleeding? Why do you have so much schmutz on your teeth? All of that kind of stuff, and fix that before we put a scaler onto their teeth, before we put an ultrasonic scaler on their teeth, before we polish, before we did any of these aerosolizing kind of procedures. That will reduce the bioburden right there.
I just had
Go ahead.
I just had a patient call right before we went on the air, a new patient, and he was talking that he had had 2 implants placed on the lower left side, and he needed 2 implants placed on the lower right. So I asked him what he was doing at home to reduce, to take care of his mouth. And he said, well, I'm brushing, I'm flossing, I use some dental picks. And that's from what you're talking about now and what we're talking about, that's not nearly enough to do. And so I had a whole lecture with him. I spent 5 minutes explaining to him, what his bowel burden and his acidity and things. So it's a huge, huge education point that we need to get across to our patients.
And once we put it into context and say, we're treating all of our patients this way, and that's going to be safer for you when you come because the people before you were as clean as you are, is going to make a huge difference in our treatment planning and our own health. I think that's what hygienists are mostly wigged out about. So we have a thing called PerioProtect trays. We can ask our patients to be putting on these trays or using the gel that goes into the trays. And we can ask them to brush with a particular kind of a gel before they get into the treatment room. And we can use ozone. You've heard me talk about ozone incessantly on every single dental hygiene Facebook group since this thing hit. We need ozone. This is going to be our savior. Our practice is not elective. Dental hygiene procedures need to happen. What can it look like though is going to be different. You may start with a telemedicine appointment. You may start by talking to each of your patients online for the first 2 months. You may never see a person in your chair. You may get them into their perio trays. You may get them into getting the schmutz off their teeth more. You're going to lower that bioburden from the aerosols before you ever see that person. That's one really decent option of getting to the bottom of this whole thing. Remember, all of our medical people now are talking about root cause. And we're like, oh yeah, we're about prevention. We're all the prevention people. No, we're not. Now we have an opportunity to be really preventive. So that's the biggest thing that we have here. And ozone is part of this, like hand and fist, like completely. So I'm going to turn it over to Dr. Zaransky. He's going to share his slide deck so that we still get the Spanish translation up at the top.
Okay, so
you go to slide share like we did before.
I did. This is not gonna.
There we go.
Okay, so I don't have so let me go back just a sec here.
Sure.
And to talk more to your point about the toxic load is that there's a lot of things that we can do before the patient even sits in the chair to make it safer for us, is having them rinse with, and if you don't have ozonated water, which we talked about, you should have, something, a mouthwash, anything that you can rinse to lower their bioburden before they sit in the chair is going to reduce the aerosol, the toxic load of aerosol coming back at you. And you talked about brushing before treatment. Well, that goes into it also. But the ParaProtect trays are great because they're so intimate to the tooth and to the teeth and to the gums. And also you could put ozonated oils into that ParaProtect tray and drive the oils subgingival. You could also make Invisalign trays, which are very intimate to the teeth and the gums, and put ozonated oil in those. And that would help reduce the bioburden too, the biofilm and the bacterial load in their mouth. These are all things that generate, all the tools that generate aerosols in our office. I have been going out and training offices how to use ozone. And typically one of my first questions to the hygienist is how many have or are using airflow or air polishing units. And pretty much out of the 100 or so offices I've trained in the last couple of years, nobody's really using airflow or air polishing units, which I think is huge. I mean, I know that there's more aerosol, but you know, the twirly cups aren't doing the job. They're throwing sand back down that clean root surface that you're working on. But you can start to see that if we have ozonated water, which is going to kill bacteria, kill fungi, kill viruses in our water system, all of these tools use water anyway. So if we're putting ozonated water in, we're going to reduce, just by default, we're going to reduce the bioburden in the aerosols. If the public knew that it was legal for us to have 500 million colony-forming bacterial units in our water lines, they'd be disgusted. They probably would never show up at our offices. Every time that patient sucks on Mr. Slurpee, they're getting everybody else's bacteria in their mouth. And also the offices, there's probably 40% of the offices in the country are hooked up to the city water. And that's a huge, system of solid. It's got solids, it's got chlorines in it. It's got a bunch of things in it that we don't know. And if you don't have a filter system that interrupts that feed from the city, I think there's a lot of stuff in your water lines that's not being addressed. So putting ozone in the water lines can reduce that to about 0 to 20 CFUs, which is huge. And if that's, I definitely think that's a marketing point for you to park. The spray wipe spray, that's what we learned in school. Do we really have time to do that? Are we really doing that between patients? The wipes that we have out there, I challenge you to go look at your container of wipes and look at the ingredients on those wipes and see what the cautions are, because most of them are liver and kidney toxic and they go through gloves. So, and if we were to do a CSI and take our blue light to our offices and look at all the walls, the carpets, the floors, everything, and see, how infected they are, I mean, it's a pretty dangerous place to work. And how have we been dealing with them in the past? We haven't. So it's scary to go back to work into these offices that we've been working in for all these years. So I think these are some of the ways that we can do it. But, obviously, like Shirley mentioned, we're going to talk a lot about ozone. And I think that's, it's almost a wonder child in terms of what it will address and how much it will kill. It's going to disinfect quite a bit. These are just definitions. In the dental office, we're looking at intermediate and low-level disinfection. So it's showing, what these things will disinfect or what will kill. I mean, so if we just use low-level and intermediate-level disinfection in our dental offices, you can see we're not even addressing the bacterial spores. So everybody that's got spirochetes and spitting out onto us and our walls, that's not going to be addressed. We've learned, hygiene school and in dental school, that if we just remove things, then everybody's going to be happy. And, you can see that it's not working. And I think it's a perfect time to change our paradigms and to do something else. I mean, what are patients afraid of? And if we can start to do things that are going to reduce that risk and reduce the sort of the pain and the problems with going to the dental office, and not take it away, I think this is a perfect time to change that. you know, we look at the dental office as a very toxic place. So why don't we make it less toxic? Why don't we make it safer for us to practice in and us to be in, and make it safer for our patients? And it's a great, to the dentists out there, it's a great marketing tool to use. I mean, if you're gonna do all this and create a healthy environment, I think you need the tools to do it, and I think Ozone's perfect for that. You know, these are just definitions to kind of give you a sense of, you know, what we're allowed to do and what we should be doing. But in the dental setting, these are things that we need to be addressing. And we're not addressing all the organisms that could possibly come in, which is a little bit upsetting to me, should be upsetting to anybody. Um, Surface disinfectant. Are we really wiping down everything? And you know, look at these. I mean, they all have hides in them. They're not all carcinogenic, but they're certainly not very healthy for us. I mean, if we were going to drink these as a as a beverage, I don't think that we would be really happy with using any of these or putting any of these into our bodies. So why are we using them to disinfect our dental office? You know, why are we exposing ourselves? The CDC, which I'm not holding out for the truth on anything right now, but this is their definition of, you know, use in the dental office, we can use low level and intermediate. We don't need to use high level disinfectants in the dental office. They can, you know, obviously damage our equipment. The EPA classifies the pathogen in our office as pesticides. So we can actually use pesticides in our dental office. And it's just one more point that it's not a very safe place to be. Here's my friend, and we're going to talk about ozone and what is ozone and how does it work. You can see by the structure of this, and I'm not going to go into chemistry stuff, but the structure is very unstable. If you have a positive negative charge, you know just by using magnets that that's not very stable. So it's going to want to grab stuff. It's going to want to react with things. And so when we look at it versus chlorine, bleach, which has been our go-to disinfectant for years in dentistry, that's what we've learned to use to disinfect things. Look how much more powerful ozone is as a sterilant than bleach. It's 150 times more powerful in killing bugs than bleach is. It works 3,500 times faster than bleach. And the big point is that there's no toxic side effects from ozone versus bleach. I mean, you know, you're not going to drink bleach. So with ozone, you can certainly drink it. The drawbacks to it, I think, are that it smells bad, you know, and it can be toxic if you were to breathe enough of it, but we're not breathing, you know, we're not breathing a lot of it. Ozone goes back way back in history. You know, it was sort of discovered in the middle 1800s, 1840s. Schoenbein gets credit for it, and they were actually using ozonated water to wipe down surgery rooms in the 1850s, 1860s. But dentistry, you can see in 1932 was the first dental use of ozone, and you can see where they were using it in World War I. This is around the time when Nicholas Tesla, the fellow who invented the cars, he was using ozone. He was building ozone generators. He was selling ozonated oil in the Sears catalog. So it goes back a long, long time. So 1932 to the present, that's a long time to be used in dentistry. In 1934, in this country, in the United States, not in the world, but in the United States, the AMA shut down ozone use. It's kind of like what's happening now. But in 1994, Dr. Atkins, the fellow who did the Atkins diet, he lost his license because he was using ozone, but he went to court to get it back. And that Superior Court decision allowed alternative treatments. So that made it legal in this country to use ozone. So this addresses the legality of using ozone in your office. You can see that from a medical standpoint, there was a lot of use around the world for ozone. It's basically how it works is bacteria and fungi have cell walls, so it breaks their cell wall, so they die immediately. There's no time for them to mutate or to change form. Viruses, it interrupts their replication cycle, so they die. So COVID-19 is a virus. It's just it's put together just like any other virus, and ozone will kill that. Prions or prions are the thing that cause mad cow disease. It's not a big deal in this country, but it should be. They are they will stick to stainless steel instruments. That's what we use. In the UK, all perio and endo instruments are one use. They need to be thrown away after one use. If you don't, you can get reported. In this country, we're not addressing it as much. It takes 168 cycles through our autoclave to get rid of a prion off of a stainless steel instrument. Ozone will kill it immediately. So I think we need to be using ozone. We should be sterilizing our instruments with ozone first. These are things that I think we could, give to patients, recommend to them, like that fellow who called me. There's a bunch of things. Why isn't he using a mouth rinse? I mean, he told me he's using Listerine. It's got a lot of alcohol in it. He's already got a dry mouth. Why are we going to make it even more drier? So I think a lot of these things, we can give ozonated oils to people to take home. We can freeze ozonated water into ice cubes and give it for them to take home. These things are so easily accessible, and they're very inexpensive. Ozonated water, I think, is a great place to start in your office to talk about disinfecting things. It's not going to leave a chemical residue. It's not going to smell. I mean, it's going to taste like pool water, but it's not going to be too obtrusive. And you could get the concentration wise, when you ozonate water, it's probably good for about 2 or 3 hours in patient clinically wise. This is typically an ozone water setup that we've used in the past. It's not very much water. This is something that I MacGyvered in the office. So I have 5 gallons of ozonated water on demand. And I think this is something I'm working on getting. We're all working on machines that we can have in the office that will give us more ozonated water on demand. So you can see, we can put it in our water lines. We could even just give the patient a cup of ozonated water, say, Mrs. Jones, please rinse with this and swallow it. We can syringe it. We can put it in our air water. We can have it in our ultrasonic or our piezo scalers. We can use it if we're going to do endo. We can do it that, and people can drink it. I mean, people come into my office and fill up their water bottles with ozonated water. So I think I just threw a couple things down here that we can use it for. I think if you could take a paper towel and dip it into ozonated water and wipe everything down. I think you'd be doing really well. Just like we talked about earlier, we can have rinse and swallow. You can have ozonated water in your whole unit, and the air water, and then in all the tools that you use. And restorative, you can have it rinsing. It's also going to take off if your dentist is using composite materials that do have BPA-like chemistry in them. It will rinse off and it will eliminate some of those estrogen-forming compounds. Even though they took the BPAs out of composites, they still left the same chemistry, and bis-GMAs and Ds and Ss are still precursors to BPAs. So you still have estrogen mimicking properties in those materials. This is a water unit where you could hook it up to your sink and you could have ozonated water on demand. This is something you can use in your laundry. And you don't need soap, by the way, with this. This is great because you can save on soap and it whitens your clothes a lot faster. Safety of ozone, everybody I think is worried about that. In Germany, they reported these many side effects, mostly coughing. If you give somebody too much, if you don't have that high volume suction right next to the applicator that you're applying ozone with, you're going to get somebody coughing. And that's really the worst side effect that you can have. It's very irritating, and it doesn't need to be, because the high volume will take care of all the residual stuff. I mean, you can compare it to allopathic medicine, a lot safer. And when we're talking about exposure, we're talking about a level of 100 ppm for 10 minutes is what a toxic level is. And you can see where we're using 1 × 10⁻⁷ or 6 ppm, hugely smaller than what is a toxic exposure. So in terms of OSHA, I've had an OSHA consultant come in my office. They gave a definite thumbs up to what we were doing. The maximum exposure over 8 hours is 0.1 ppm. So you can remember that we're using 1 to the -10 ppm in terms of concentration. I mean, yes, you can smell it, but it is not toxic to us as humans. The maximum is 0.3. We're not even coming close to this stuff. I think that might be a good idea if you wanted to just buy a generic ozone generator online for a couple $100, and at the very end of the day, just turn it on, let the timer go for a couple hours after everybody leaves. So I think these are things that we need to look at. I mean, this is our list of things that we need to address before we go back to work. I know you all are pretty scared about going back to work in our offices, and you should be. You should demand from your dentists, and the dentists that are out there should start looking at, and implementing all of these things in the office to make it a safer place. And write the list down and start addressing them, and talk to your dentist and say, look, we need to address these issues before we go back to work. That's our message. Here's our contact info, and I am happy to talk ozone all day long. So I'm more than happy if you want to email me all the questions that you want. I will talk ozone till the cows come home for sure.
So Eric, there's a couple of questions. One, can you go back to your picture of what you did with the MacGyver picture?
Sure.
So you're making water. You're making ozonated water. And
Correct.
In this picture, you see a green thing, and in that green thing is what?
So this is the oxygen bottle here is that green thing, and that's feeding this ozone generator, which is that silver box. And
What's in the green thing first? Let's stop.
That's pure oxygen. So that's medical grade oxygen. You need pure oxygen to feed any ozone generator that you use in the office. So all the ozone generators that are out there, no matter how much they cost or how little they cost, are going to generate ozone. So it's a matter of how many bells and whistles are on that machine. This machine is just an on-off. You turn the on and it makes ozone. You turn it off and it doesn't. There's other machines out there that have timers and they have dials, and they can do many different things. This one is
So this is a glass bottle.
It's a glass bottle. So you want to make sure that it's glass, because ozone's going to degrade any plastic material, any rubber that you have in there. You want to make sure that you're not using latex gloves in the office if you're going to put ozone in the air. So in this picture, the green bottle is full of medical grade oxygen. It's feeding that tube is going to the silver box, which is an ozone generator. Out of the top of that is coming ozone gas, and that is the tube that actually is going into the glass bottle. It has a ceramic diffuser in it, so it's making small bubbles, and the ozone gas is dissolving in the water. Then on top, you have an electronic dispenser, which is going to dispense the ozonated water on demand. So I essentially would have this going all day so that I have ozonated water on demand. It's probably going to take about a half hour from the time you start that machine for that entire 5 gallons to dissolve ozone in it. So you want to start it before you have patients.
And then did I zone out? How long does it take until this water is ozonated to where it's going to clean out the water lines and be useful as a surface wipe down water?
You need less of a concentration of ozone dissolved in your water to disinfect things than you do for patient care. So I would say that it would probably take about a half hour to ozonate this entire 5 gallon to have it effective for patient care. And so I think less so, maybe 20 minutes for disinfecting areas. If you dispense some of it out and you taste it, it tastes like pool water, I think you're pretty much good to go at that point. There are ozone water meters that will measure the concentration of the water. At this point, I don't think we need to get that involved, especially for surface disinfecting, where we don't need that high of a concentration. If we're ozonating this water, just to give you some comparison, at room temperature, we should be able to get 10 to 12 parts per million of ozone concentration in that water. We need about 1 to 2 parts per million to actually be an effective disinfectant on surfaces.
Okay. So in the mornings, it would be smart to get this thing running before anybody shows up.
Correct.
Then after half an hour, then you would fill up some squirt bottles and then wipe down your room from overnight. And then then you would use this water in your bottles on your unit.
Correct.
And then would you fill up one patient's worth of water in for your unit bottle at a time, or would you fill up the 2 quarts or whatever liters, and then just use that all day, or how would you use that?
I would probably fill up probably a liter's worth of water in your operatory water bottles, and that will probably get you through one patient, or maybe 3/4 of a liter would get you through the patient. And then I would go and top it off. I would fill up. I would go back to the dispenser and top off for the next patient. And just
So you don't have to dump out the last 2 inches and then fill it up?
no, because it's still got some ozone in it, so you're just topping off that water, and you're working from that. And I think if you're going back and topping off your water bottle every patient, it's just going to take you a few seconds to do that. I think you're pretty good in terms of the efficacy of that water.
Super. And then, okay, so, and now it's going through the unit. It's also going through the ultrasonic scaler. It's
Correct.
also going through your dental handpiece.
Correct.
So it's disinfecting. So they were talking about using a dental dam for dentists. It won't work for hygiene, obviously, but so when you're using this in your handpiece, you're disinfecting all the tooth schmutz that's decayed, the decayed enamel and everything that you're getting rid of. It's whatever that ozone water is touching in the lavage water for your handpiece and for our ultrasonics is killing whatever bacteria is left over.
That's correct.
Sweet.
And also too, oh, I forgot. Go ahead. The train of thought.
Okay,
Yeah,
it'll come back around, I'm
the
sure.
air water. You know, you're lavaging with that air water, and that has ozonated water in it, so that's going to reduce your biofilm also, your bioload.
Bioload, yeah.
Yeah.
The aerosol, if it's a clean aerosol, we're at really low risk. And the cheaper mask would be really okay for that. I mean, you might want to still use a level 3, but
Right.
you know, you're
Yeah,
just not relying on this stupid mask now that's made in China too, right?
Exactly.
So,
Yeah. You're definitely lowering the risk to us as practitioners for sure, with all of this. Definitely.
so this unit right here, the number 2 that I wrote on the screen here, how much is that unit? And is this a starter unit?
That's an ozone generator. I mean, I sell this whole setup for $850. I'm working on a better system and more slick system where it's all more contained. This is obviously a MacGyver setup for right now. I don't think we have a, I mean, typically what we've done before was this flask system where it only generated a liter of water, and that's just not enough for us. We need something where we can generate a lot of water for all of our operatories. So if we have 5 chairs or 10 chairs, we need enough ozonated water to cover that whole system.
What water is in that bottle? Are you filling it with sink water?
No, definitely not. You have too many solids in the water that's coming from the city, so you need some sort of filter. But ideally, you would want to use pure water or distilled water in this bottle and ozonate that. I mean, if you're using city water, it's got chlorines in it, it's got solids in it, so you're ozonating stuff that you don't know what you're going to come out the other side with.
Okay, so some of these scalar units have their own water system.
Correct.
And those bottles are some kind of a poly somebody. So is that okay? Is that going to be safe, or do we have to buy extra of those bottles because they're only
No,
gonna last?
definitely not. You can still use ozonated water in those separate bottle systems for sure. And I think that's gonna help a lot. I mean, traditionally we've gone to chlorhexidines and things like that. I mean, this is a lot safer, a lot more effective. I mean, you can look at the studies on chlorhexidine and see that at 0.12%, it's not as effective as we thought it is, and it's just making the teeth brown. So I think this with no side effects and a greater bioload reduction, I think you're doing much better with ozonated water in your bottles.
And then this unit number 2 right here, is 850, or all of these parts are
The whole thing,
850?
all the parts, the whole total system is
The
850.
whole picture?
Yeah. And
Holy moly, that's really inexpensive, Eric. Are you sure?
maybe I'll raise the price afterwards. But
I think you should raise the price.
well, no, I mean, I think getting it out there, I mean, I think everybody needs to have some sort of ozone in their office. And I think this
Yes.
is the easiest way to start. It really is. I mean, it doesn't take, you know, ideally, if you're going to start using ozone gas and oils and water in the office and start treating patients with that, you definitely need a certification course. And I could do that for you. But I think to start off with, this is something that you don't need a lot of education with. I mean, all you're doing is just replacing the water that you're using presently with ozonated water, and you're not. There's no risk to it at all. There's no side effects, and the upside is huge.
It's the perfect place to start.
Definitely.
Okay, so now let's move a little bit over to the gas itself, the actual gas. So I was talking to a Los Angeles dentist a couple of weeks ago, and he says he uses those fluffy gowns. He puts them in a bag and dumps ozone gas into that bag straight out of the generator, and he disinfects his gowns between patients. Can you also do that with masks, like an N95 mask?
Yeah, there's a lot of talk out on the internet for sure. I mean, you could take the gas that's coming into that bottled water system and reroute it into a Ziploc bag with masks in it for sure. It would probably take 10 minutes to disinfect that mask. You could also do the same thing with your instruments. You could put your instruments in a Ziploc bag and take a separate tube coming off that machine and put it into the Ziploc bag and disinfect your instruments before you put them into the autoclave, and you'd be getting more sterile instruments. But yeah, definitely you could disinfect if you needed to use PPE for multiple patients. You could do it that way. I mean, ideally, obviously, you would want to change it, but maybe.
Well, yeah, but you know, we're in a situation now where PPE is hard to come by.
Exactly.
So if we could stretch it out a little bit, it'd be sweet.
Yeah, definitely. Putting it in a gallon Ziploc bag and sticking the ozone gas, taking a separate tube from there, putting it in a Ziploc, that would work just well.
Okay, and then does it matter what you're using to wipe your room down with the ozone gas with? So do you need paper towels? Can it be cloth? If you use a microfiber cloth with silver or copper infused into it, you know, does any of that matter?
I mean, that's all great ideas. I mean, I don't think the ozone water is gonna, still, those are antimicrobials also. So they're gonna work also. If you're dipping whatever, any of those in the ozone water and then using that to wipe down, I think that's perfectly appropriate.
I like the idea that you mentioned with gassing the instruments before you put them in the autoclave. What about the jiggle water? What about the water in the ultrasonic for the instruments? So how would that go?
That would be ideal. If you had a system where you could use ozonated water in the jiggler, that would be awesome. The biggest problem with that is filling it up and then emptying it. I mean, because the ozonated water is not going to stay effective for that long, probably an hour worth. So having to empty that and then fill it back up and empty it, multiple times during the day, I think that's probably a little inconvenient. I think it's easier to rinse the instruments in ozonated water first before you stick them in there, or afterwards between the jiggler and the autoclave. I think that would be a definite compromise for sure. That would work.
All right, and then how do you measure that it's working? How can you rest assured? Can you do a measurement of parts per million in the water? And then how would you know it's working? I mean, we don't know that the Cavicide is working. We just trust it is.
Right. Right.
We have somebody to blame if it doesn't. So we got nobody to blame if we're making our own ozone. So how does that work?
Right. It's definitely a magic solution. And it's definitely hard. There are there's ozone meters that you can test water concentration with. So if you wanted to go that far, you could definitely test the ozone concentration in your water. And obviously, if it was above 1 or 2 parts per million, you know that it's effective. You could also test the gas. There are gas meters that will test the ozone in the air. If you were really worried about that, you could get ozone meters for the office to test the ambient ozone in the air. Most of mine read 0 anyway, because we're not putting out that much. Even though it smells like ozone, we're not putting out that much. But in terms of it killing bugs, you'd probably have to take whatever bugs are on there and stick them on a petri dish and grow them up over 72 hours and see what you're at. I mean, that would be obviously.
That's how early we are in this.
Yeah.
There aren't any companies that have taken advantage of this testing.
Not that I know of that are out there. No. And I talked to the company that does our the bacterial strips for our autoclave, and it just the chemicals and stuff on the strip just won't work with ozone for some reason. So I'm not sure why.
Okay.
Yeah.
So if there's schmutz on a scaler and you put the scaler in a bag and you gas the bag, in an autoclave situation, you're in trouble. The autoclave is not going to get to the bottom. It's not going to get to the interface of the clump and the metal on the instrument. How is it if you have that in an ozone situation?
So
are these questions too hard, or are they just hilarious? What is all this grinning about?
No. So we've been taught in hygiene school and dental school to remove the bioburden first before we put it into the jiggler.
Yeah.
And so if we're not doing that, I'm not sure why we're not doing that. Ozone's not going to penetrate that schmutz. But I mean, we should be cleaning that off before we're doing any of this. And so if it's cleaned off and there's a relatively, schmutz-free instrument, yes, the ozone's going to sterilize it.
Okay.
And then you can do whatever else, from a medical legal standpoint, then put it into the autoclave. And so that that, from you're doing everything that you're supposed to be doing, and you're not depending on the ozone to as the only disinfectant source.
Well, I'm just thinking because you have this little situation where you can gas it, put it in ozonated water in the ultrasonic jiggler, and then put it in the autoclave after it's dry, and then the instruments are touching one another, and is that good? And blah blah blah. But this sounds like a real good starting point. Right around the jiggler, probably before or after would be fine.
Definitely. Definitely. I think that's a great idea.
So, all right. So let's see. Linda was asking, how can ozonated water be used in instrument washer that's attached to the city water feed? Yeah.
You have so many solids in the city water, so you really need a reverse osmosis, taking out the solids in some way. You need to that's a situation where you really need to be testing your water to look at how many solids you have in there, and what kind of bio load that you have in there to begin with. Not that it's toxic, but you don't want that interfering with everything. It's a lot easier to be using distilled water and having that run through everything. I mean, that's what I use in my office anyway for everything else. But to use distilled water to ozonate first makes a lot more sense, because you don't have any other, issues or any other contaminants.
I'm thinking of the flow, and I think you could put it in the washer, because they're in a cassette in the washer. They're not like rubber banded together in the olden days.
Right.
And then you put them in the washer, and then you could do a little ozone stop in a little cabinet, and then put it into the oven. That could be one way around it.
There's a lot of different ways to do it, and I think everybody kind of comes up with their own solutions. But the fact that you have a supply of a lot of ozonated water makes a lot of sense, and you can use it pretty much any way that you want to use it in the office. I mean, if you're going to be using generators, you're going to have to figure out how to reduce some of the excess gas in the air. But I think at this setup right now, as it stands, there's a little bit of excess, and you can can figure out, because charcoal will actually destroy ozone back into oxygen. It will turn it back into oxygen. So you could have either charcoal bags, you could silicone the areas that are leaking, but you shouldn't have ambient excess ozone gas in the air. So you're going to have to figure out how to manage that better.
Okay, so if you'll give up the screen, there's a couple more questions. One is, are there any machines available for purchase for a hygienist that they could just do their own little water? So, you know, chair side.
Yeah, definitely. I mean, I think that they could have a setup like this on the sideboard, and they could be making their own water. I mean, this makes a liter, so that's going to be probably enough for one patient. So they're going to have to look at that. That cup is something where you could put cold water in, and you could actually cool the water down. You'll get more ozone dissolved in the water than you normally would at room temperature. That stick on the right side, that tube, is what we call a destructor. It either has charcoal or magnesium chloride in it, and will actually turn the ozone back into oxygen. So that there's always some excess gas coming off, and then that will serve that purpose. But yeah, they could definitely have this on the sideboard if they have enough room on their countertops, for sure.
So Dr. Kammer posted that there's a little gadget from Amazon that you can test for solids in your water.
Yep.
To give up the screen, you'll go up to the top and there should be a stop screen share. I've worked in offices where they have a little gadget on the counter, and you just make a little bit of ozonated oil for yourself.
I would yeah, I mean, you could do that. I would discourage making ozonated oils in the office.
Oh, no, not oils. No, water. We're just talking about water.
Oh, all right. Well, the oils is a different discussion, but I think you should definitely not be making ozonated oils in the office. They're exothermic, and you could create an explosion. So it's not
So
something.
yeah, one of the questions was, what about oil?
I think there's plenty of places. I have my website, ozoneoils.com, and you could buy the pre-made ozonated oils from that. There's other companies, there's Primal and Puro 3 that make ozonated oils. Much easier to buy it already made. And then if you want to dispense it from that jar, easy enough to do. But I would not recommend making it in the office.
I'm with you on that. I lost my little question feed here. Oh, there we go. Oh, chat. Okay. Okay, so a couple things. Let's see. The ozonated oils. So how do you use the ozonated oils? Hold on. Before we leave the gas, I think everybody who works in dentistry should do ozone ear insufflation at least before they leave. What do you think about that? And can we talk about that for a second?
I would agree with that, and then that's getting into the gas.
That's the gas, right?
Into the gas, you need a generator for that. You need to have a system where you're dealing with the excess gas. Putting it into your ears will actually get into your whole systemic system, and I think it's great for overall health. I think you should investigate doing that, and I think ozone, from a personal standpoint, is all the people on this webinar should be doing ozone personally for themselves to become more healthy. I think if you go to oils, this is where we talked about the trays earlier. The oils are great because the ozone will actually bind to the fatty acid chain of the oils, and it will stabilize over time, so that they stay stable over years. Some people say they stay stable for 10 or 15 years. So you can actually give the oils to the patient to take home, and they could use them, say, with a little interproximal brush, a tipping brush, or interproximal brush, to dip in the oil and then place on the gums. Leave that overnight. You could put them into trays. You could make Invisalign trays. You could use the ParaProtect trays and then put the oil on that and leave them on all night. It will be effective all night, even though the saliva might get into it. I think those are great. I mean, I think you're going to see a huge difference between recalls if people are actually using the oils on a regular basis.
So the question was a little bit more specific. So the way to apply the ozonated oils in the office is to go back into your dental hygiene kit from school and bring out your Dappin dish that you've never used since you graduated. Put a little squirt of oil, like a tiny squirt of oil, into that Dappin dish, and then put your perio probe into that, and then just apply that oil into the sulcuses and into the pockets as you go around. There's other ways dentally to use ozone oil, but I really wanted to focus on infection control parts.
Yeah, definitely.
For this webinar.
I think that's a great way to do it. Another way to do it would be to take a small syringe and put a little bit of oil in there, maybe a half a
Oh,
cc,
that's
1
smarter.
cc, and then you could put one of those prevent tips that come with the etches. Steal one of those and put that on the end, and then you could go into the sulci with that. You could just put a couple drops in each sulcus.
And then whatever is in there is kaput, and then you can ultrasonic away till your heart's content, and not have to worry about these poisoned aerosols.
Definitely, and you could do that at the very end also, just as the patient's leaving, to leave that sitting there and working after they actually leave the appointment.
Do you charge extra for that level of treatment?
I don't, and I probably should, but I think that's going to be up to the individual offices to look at, you know, what their fee structures are and what they want to do. I think it's definitely a value-added service that you're providing. So I think that, yeah, you should be definitely charging extra for it.
Yeah, I don't think patients would mind a $5 upcharge or increase
or
your fees by
whatever it is.
$5 or something.
They're certainly not going to go down the street to the next dentist because he's not using ozone. So
Right.
you're one in it.
So we're offering ozonated ozone ear insufflation at Primal Air for people that can stop over here. Is
Right.
once a week good enough for that, or does it have to be every day? Can we sell
No.
a package of 5 times, or what's the?
Well, I think
Where's
it's going
your
to
outside?
depend on, you know, it's going to depend on the person. I mean, I think if they can't breathe through their nose and their sinuses are stopped up and they're getting ear infections a lot, then yeah, maybe every day would work. But if they're doing it just to maintain things, maybe once a week or once every couple weeks is fine.
Super.
I think we had a question about what type of oils to ozonate, and pretty much you can use any vegetable oil. What you have to realize is that once you ozonate an oil, the oil is just acting as a carrier for the ozonides. So they actually will bind to the oil, and they're called ozonides at that point. So the ozone's just acting as a carrier. So the more double bonds that oil has, the more ozone will incorporate into it. And so you're not going to use something really expensive like an essential oil or things that are more expensive, but you're going to use things like olive oil or sunflower oil or safflower oil.
They're not going to use it, they're going to buy it from somebody,
exactly.
right?
So,
You don't
yes.
want them to do this at home.
Correct.
Because you've already exploded how many garages? I've heard stories of you ozone guys.
Yeah, everybody.
My department was out again yesterday.
Yeah, they've all blown up their garage at some point.
This is recorded. It's on YouTube Live, and Philip has put the link of this live onto our Facebook group, the Primal Air Facebook group, and then we're going to put it also on Dr. Zaramsky's Facebook group also. This is awesome. This is exactly what I was hoping would come out of this meeting. I'm hoping that everybody else is as excited about Dr. Dome, not Dr. whatever you just typed in there.
A couple quick points before is that no, the plastic bottles in the operatories aren't going to break down because the water's not going to break it down. It's not in there long enough to break it down. And are there any schools using this? No, schools are just teaching you to be basic beginners. They're not going to do anything so involved that they're going to teach this kind of stuff. You should know that everything you learned in school isn't correct anyway. So
Not after a week after you get out.
Where may we
So,
get
more info, yeah.
more info? Just, you can email me for sure if you have any questions, or Shirley, if I just want to buy us. Just email me with questions about where to buy stuff and where to get stuff, and I can help you with that.
So here's the thing, you can buy an ozone generator and create your own little system, just like Dr. Zaransky did in your office or in your treatment room. And you can start working with this within a week. If you want to know more about how to use ozone gas and inject it into places, and to use the oil for endo and all these other things, there's way more about ozone, way more. He's still going out to offices for training, but he's just hired a videographer to do a video series of classes that will be living eventually on the IAOMT website. So there's that.
For sure.
But that won't be free either. So it's just going to make it easier so he doesn't have to fly around the country all the time.
Yeah, definitely.
So this has been great. Thank you everybody for coming. We had an overflow situation, so we're back on again tomorrow at 10 Central. So we're going to redo this because we only had room for 100 people on here. We had 160 people register. I think our maximum was 61 people. Everybody pretty much stayed throughout the whole thing, so that's pretty cool. There are no CEs for this. I'm so sorry. We would have to charge $100 a person for me to be able to get CE accreditation, because I would hate doing that. So
when I do go out to offices and I do certifications, there are CE credits. I think
Super.
it's 14 or 18 units that I give out. So
it looks like you and Chris Kammer are the only guys here in Phillip, so it's all good.
He'll have to deal with it. Yeah, it's fine. So
Thank you, everybody. I'll see you tomorrow, Eric, and have a great rest of the day, and spread the news, man. It's not dangerous out there if you're using ozone.
great. Good luck, everybody. Thank you.
Thanks, everyone.
They gotta come up with some plan.
Bye, Eric.
Bye-bye.
Shirley.
Thanks.
Bye, Shirley.
Thanks, Eric.
Thank you. Talk to you soon.
Thank you, guys.
Okay.
Great. Hi. Hi, kiddo. How are
Say
you doing?
hi, Axel. You're on camera.
Hi.
That's
Hi.
Dr. Eric.
How are you? Hi.
Say I'm Axel.
What are you doing?
I'm Axel.
You having peanut butter crackers?
Yeah, what are you doing right now?
He's sitting on mommy's lap having some snacks.
Yeah, and I'm going to show you a thing that I